Greetings friends, David J. Coon with Qigong Awareness. You may have heard a rumor. When I was 12 years old, I was on a hayride. I jumped out of the hayride. I ran across a tree farm. I got to the other side of the forest, tried to jump back in that trailer. The trailer, in the dark, grabbed my right leg, yanked me down to the ground, ran all the way over my right leg, all over the right side, all the way up over the right side of my back, and created a lot of severe back pain for many years. Degenerative spinal disease called scoliosis, and by the time I was 25 years old, they said that my spine looked like I was 85. It was not fun. I stand here before you at 56 years young, and I have healed my spine using practices like the ones that I'm going to show you. And without further ado, let's get to it. Many things to teach you, many things to talk about. I've gained a lot of knowledge over the last 41-ish years of practicing traditional Chinese medicine, a specific form of Qigong called Medical Qigong. It's not for everybody. Some people just like to exercise and don't like to hear somebody like me talk. But other people who want to get to the source of what might be happening with them and how they might best work with their bodies like to listen to and hear much of the knowledge that comes along with things like acupuncture and medical Qigong. Going here with your hands, brushing the hands like so. Because medical Qigong gets more specific about the problem and therefore the solution. In that way, it's similar to Western medicine, but rather than using pharmaceuticals and surgery, we're doing it a bit differently. So when you raise your hands, just to start going like this, where do you think the blood in your arms is going? Any idea? It's going to your heart, back to the lungs, back to the heart. First, we have the blood now moving via gravity. You're getting some extra movement. You may not realize it. Some of you, when you go for a walk outside, you're walking. Your arms, maybe you walk for an hour, your arms start getting really tired and tingly. Do this while you're walking. Hands come up in the air, shaking the hands, get the blood moving down the arms, back toward the heart, back toward the lungs. Brush, 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 brush. Now, if you have back pain, one of the problems that you have guaranteed is the circulation problem. So we need to move that blood around. What we also need to increase is the circulation of qi. What is qi? Well, in general, you could think of it as energy, but we might even think of it in certain instances as electrical charge. All of the cells in your body, all of them work off of electrical charge. All the way down to the DNA. So keeping that energy, keeping that electrical charge moving and keeping it balanced, very, very important. These are some ancient exercises to do it. So these are some exercises that whether you have upper back pain, lower back pain, mid back pain, right now I'm just addressing this as an overall practice. If you'd like to see a very specific course, check out my online course. It's a CEU course. Acupuncturists can even get CEUs for it. And it's called Medical Qigong for healing back pain. But for right now, let's just have fun with this exercise and get some circulation going and move some blood, move some qi. And you may notice that as you're doing this and as we go along, it's going to start to open up your breath. So there's our gentle drum, settle. We're going to come into a waterfall. Inhale, exhale, go. Blow it off. Blow off some steam. I want you to come back this way. Inhale. Exhale. I want you to go here like bird's wings. Inhale. This is going to be exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And when you inhale, you have to be careful. I don't want you inhaling and lifting up your chest. You have to breathe slow enough that you're breathing into your lower belly. If you breathe slow, or you ever hear me say breathe slow and low, that's what I'm talking about. So if we breathe quick, comes up here to the chest, that's half of our problem. So we need to breathe slow and low. So when we're here, we're gonna come up slow. Inhale. Hold the breath for a second in our lower belly, tighten our lower belly, and then try and touch your middle fingers together right here as you look up and exhale. Now come up, we're gonna go to a waterfall. Imagine a big waterfall over you, running over your body. Whoa, like a whoa sound, like you're saying whoa, but deep, like whoa. We're going to start tapping right here on the sides of the legs. Some studies say and suggest that approximately 70% of the toxins in your blood are removed through your exhalation. So these exhales that we practice are very important. They're just as important as the inhalation. We're bringing in new oxygen. We're bringing in new qi, which is said to ride on the oxygen. I'll talk about that more in another set of videos. There's only so much we can get into in this one, but understand that when you're breathing in air, it's not just air, it's not just hydrogen, carbon dioxide, nitrous oxide, oxygen. There's prana there, there's ki there, there's chi there, there's something very vital in that energy. While we're tapping the sides of the legs here, this is a very common area where people get pain in their legs. It also happens to be the main area, the largest area, a large area of musculature, but a large area of the gallbladder meridian. Gallbladder meridian runs right here. Acupuncture meridian on the side of your legs, tapping right here. This ache in your legs, whether you feel it here or you feel it here, guess where the gallbladder meridian runs? Right here. So you're tapping here. This contributes to a lot of lower back pain. So just light tapping here to clear up what we call the blood qi stagnation. We're now going to come, if you can reach back here, we're going to come here and we're going to tap here also. Good. And now some of you won't be able to reach up here. So I want you to take your other hand in some capacity like this or this, reach it up so that you can reach. And I want you to kind of try and get a light tap going on your shoulder, on this upper back area, breaking up some of that blood qi stagnation. I feel like a little baby right now. My mom's patting me and I just burped. That is a very good sign of increasing my digestive activity. I'm going to come over here. Guess what meridian lives up here too? Gallbladder meridian. This is a very common meridian I've noticed in my 40 years of practice. I've noticed contributes greatly to people's level of back pain and or their health and vitality. Excellent job. Brush your hands off. Hold your hands like this for a moment. Take a breath in. Now one last tip. In combination and in conjunction with those practices that I just showed you, I highly recommend that you go drink a tall glass of water. In fact, you might need 2 of them, and I highly recommend you add a little bit of lemon into that water. It can give it some flavor and so on as well. But this is very good for your liver. It's very good for your blood. It's going to break up the stagnation that you're feeling in your body and in your tissues, and in your meridians. This is highly recommended. And it's also recommended if you haven't seen 21-Day Qigong Challenge, just 10 minutes a day. We have a course online where you can practice every day for 21 days. And if you skip a day or miss a day, no problem. You have that content ongoing. It takes 21 days to change any habit, so I highly recommend trying to practice Qigong for 21 days in a row. Also, combine that 21-day practice with drinking your water. Watch what happens to your back pain. Send me some comments. I'm very excited to hear how it works for you. All right, thanks guys for tuning in.